Hello, this is Dr. Kashif Sangrasi. I'm a medical practitioner and I've been doing public health since last 8 years. Diabetes is a medical condition in which there is excessive blood glucose in the body, and it leads to several complications if it's left untreated for longer times. Diabetes comes with different types. One of them is type 1 diabetes, the other one is type 2 diabetes, and then we have gestational diabetes. All of these have some similarities when it comes to having the high blood glucose. However, their causes may be different. Type 1 diabetes is a hereditary condition which happens because of family history, and in this case your body is not producing insulin, and it leads to severe complications when you grow up. Type 2 diabetes is a diabetes which is normally a late onset diabetes. It happens mainly because of your body develops resistance against insulin, and in this case normally the symptoms appear after 30 to 40 years of your life, and they continue to be there. It's slightly more problematic in the longer run. However, their complications are more manageable by lifestyle modification and medication if you're using that. Serious complications may lead to be there because of persistent increase in your blood glucose. It may affect your eyes, which is called retinopathy, your heart, your kidneys. It may affect the pregnant ladies, which is called gestational diabetes, and it may lead to complications. And there will be complications on the skin and a lot of other organs. Modification of lifestyle is the cornerstone when it comes to managing the diabetes, especially type 2 diabetes. The more you are active, the less chances of your body is going to be developing these complications. Apart from the lifestyle modification, your diet plays a very important role. Avoiding foods that are very high in carbs and going for a more balanced diet is going to help you in the long run. If you still have uncontrolled diabetes, which can be checked either at home or through some glucose testing, you will need perhaps some of the medications, either oral or insulin, but that will only be done via prescription from a medical practitioner. There are several diabetic emergencies that may be there if persistent blood glucose levels are increased, and they can happen in type 1 diabetes as well as in type 2 diabetes, but more so in type 1 diabetes. A severe complication which happens is called diabetic ketoacidosis. In ketoacidosis, the acids in the body do increase to a level whereby they will cause certain symptoms. Diabetes, as we mentioned previously, there are different types. With type 1 diabetes, mainly it happens because of certain genetic and hereditary factors, so obviously it cannot be prevented. However, type 2 diabetes can be prevented easily if certain preventive measures that we already had mentioned when it comes to lifestyle modification and exercise and diet modification, especially in the case if you have the family history and other risk factors, you will need to take these into account. They will help you prevent the diabetes in the first place. The other type of things that can be prevented is gestational diabetes. So gestational diabetes, when it happens for the first time, is actually a signal for any pregnant lady that they are going to develop diabetes in future, which essentially means that the symptoms are going to be only there till lady is pregnant, and once they are not pregnant, the symptoms do return to normal. But these type of ladies are always predisposed to type 2 diabetes, and lifestyle modification and diet is cornerstone for each of them. Take home message is very easy. Obviously we can only beat diabetes by staying active, eating healthy lifestyle, and trying to take care of our health as much as possible, because diabetes, if it is left untreated for longer periods of time, it is ultimately going to affect you and your body by causing severe complications and affecting your quality of the life. So take care of yourself. Thank you.